In the last video, you learned that during the cataract surgery, the cloudy lens is removed and a new artificial lens is implanted in your eye. This artificial lens will stay in your eye for the rest of your life and would basically determine the quality of your vision in future. To allow the surgeon to pick the correct lens for your eyes, thorough and accurate measurement of your eyes are necessary. There are two basic methods to do this measurement. The one on the left is the ultrasound biometry. There is an ultrasound probe that touches your eye, and it will use ultrasound technology to measure the length of your eyeball. This method is generally less precise because it depends on you as a patient, whether you're looking at the right direction or not, and also depends on the operator, the person who is using the test. There is a lot of variability, and the quality of the measurement can drastically change depending on those two factors and others. This technology uses older and more basic formulas to calculate the lens power. These formulas are about a decade old. Now, the good thing about this method is that it's covered by OHIP, so there's no cost to you. However, again, it's variable and it depends on older technology and older formulas. Now, the technology in your right is optical biometry. This is the most modern way of measuring your eye, which allows the most precise calculation of the lens for your eyes. Almost most people in the first world countries, even some developing countries, use this technology now because it's proven records. It's non-invasive. There's no contact is made with the eye. It's more comfortable for the patient. Uses very advanced technology to measure multiple parameters of the eye, including the length of the eye, the curvature of the cornea, lens thickness, anterior chamber depth, a lot of anatomical information from the eye, which allows a very accurate measurement of the eye as well as precise IOL calculation or lens calculations. They also uses a very advanced formula to calculate these lens powers. And the only reason we can use these advanced formulas is because of all the data that we have provided from this technology. The downside to it is that it's not covered by OHIP. Prior to your visit with us, you have to make sure you pick one of these two options. Patients often ask me what my recommendations are. Optical biometry has been the gold standard way of measuring the eye for the past decade or so. So I definitely recommend the optical biometry. Now I have to mention that whichever you choose does not affect the safety profile of the surgery. The surgery is very different than the measurements. However, depending on which one you choose, it affects the visual outcome of the surgery for sure. And the visual outcomes tend to be better with optical biometry because, again, of a better accuracy. The next important measurement that we need to discuss is assessment of astigmatism. Now, astigmatism is a difficult concept to understand. However, I tried my best to explain it here simply. Almost everyone has some degree of astigmatism in their eyes. Astigmatism occurs when the surface of the eye is shaped like a football instead of a soccer ball. Now, if we leave this untreated, astigmatism will cause blurring of the vision after cataract surgery. So basically, the astigmatism can be fixed two ways. We put a regular lens, OHIP lens inside the eye, and we correct the astigmatism with glasses after surgery. Option number two is to put a lens inside the eye that corrects astigmatism and cataract at the same time. That way you minimize or eliminate the need for glasses. Now, for me as a surgeon to advise you correctly whether you do have astigmatism or not, and how much of astigmatism you have, and whether these lenses would help you to eliminate your astigmatism, we need to do this measurement as well, which is called corneal topography. So basically, before coming to the session to assess your cataract with me, you need to make a decision on which option you would be interested in. Basically, either a corneal topography that is not covered by OHIP, or you might say that, you know what, I'm not interested in correcting my astigmatism and I'm okay with wearing glasses after surgery. And if you ask me whether I do have astigmatism or not, I cannot answer that question unless I have this test in front of me so that we can assess. So this is basically a picture of the device that measures your corneal surface, and this is a kind of map that I will look at when we see you in the office to determine how much and whether you have astigmatism or not. Now, corneal topography is a non-invasive medical imaging technique for mapping the surface curvature of your eye, which is named cornea. Since the cornea is normally responsible for almost 70% of the eye's refractive power, its topography is of critical importance in planning cataract surgery and lens implantation. So I urge you to consider this if you're interested in the refractive outcome of the surgery. Again, whichever option you choose does not affect the safety profile of the surgery, but it certainly does affect your visual quality after the surgery. And again, this test is not covered by OHIP, and the exact fees is very minimal, and we will give you exact numbers in the office. Here I will demonstrate to you how astigmatism would affect your vision. So imagine this is a normal person, healthy eye that sees the distance, the mountains very clearly. It sees the phone very clearly, and the intermediate, the sign postage here, everything is clear. This is a young, healthy patient. Now, imagine if this patient also has astigmatism. This is how things look. Everything is blurred. Now, typically, we can put glasses on and fix the astigmatism with glasses. So it will correct it, and this is how it would look. Now imagine if you have cataract surgery done, and after that you end up with some astigmatism, which you decide not to correct. So this is if you put a regular lens, and this is how it simulates how the vision would look like after the cataract surgery if you do have astigmatism. Now, there is obviously a different degrees of astigmatism, which we will determine by the test that I recommended. And this is, I'm changing the amount of astigmatism. This is obviously a very large astigmatism. This is a minimal astigmatism that I might not even correct. And this is what some people have, like a mid-range astigmatism that I would definitely recommend treatment with a lens. So this is if you put the regular lens. Now, if you put the special lenses that corrects astigmatism, let's see how it looks. You see how everything looks crisp and clear.